In the Central Berkshires, isolation isn't just a matter of miles. It's the space between need and access, between fragile systems and the people they're meant to serve. When the pandemic arrived, those gaps widened, but instead of rushing in with top-down solutions, the Berkshire Regional Planning Commission chose a different path.
Our organization's motivation in pursuing funds like these came out of a common experience I think a lot of organizations had during the pandemic, is that many of our systems were already very fragile, and the pandemic exposed the cracks in those. There was already food insecurity, there was already people facing homelessness. There were already these gaps in services, and COVID just made that so much worse.
And in rural communities, even recognizing the need can be a challenge.
And in rural areas especially, it's very hard to find where people are struggling just because of distance, because of isolation, maybe because of the sense a lot of people have of being very self-sufficient out here. People choose to live in a rural area, and they sort of accept that sometimes you'll be out in the woods by yourself, and that's part of your identity until you really need help.
Jamie didn't make assumptions. She started with a simple question. What do you need?
I reached out to town officials. I reached out to boards of health, councils on aging, every single service organization that I could, to ask them, what are you seeing? What's going on? What do you need? What we heard out of those interviews is there's a lack of services for children, huge issues of isolation, especially among older adults, and food insecurity.
From the beginning, BRPC focused on removing obstacles and building trust.
We want this as open as possible. We want it as low barrier as possible. I'm not a direct service organization. These are direct service organizations. They have community ties that we, BRPC, do not have.
From small town playgrounds to county-wide health services, the outcomes were tangible.
We were able to set up a fund through the school for each nurse's office to buy that food that they needed to have those snacks for those kids. Later, when I heard that a local partner had a new dental van, I organized a meeting. There are as many schools as possible, starting with the nurses' offices and having them spread the word up, and got a lot of schools across the county on a call with the new mobile dental van to talk about how those services could benefit them.
And in a county where access is everything, even the water became more accessible.
And as far as we know, those are going to be the first 2 water wheelchairs available to the public in Berkshire County.
But not every need could be met, at least not yet.
One of the hardest conversations I had with an organization, it was an elder services organization, and this organization wanted to accept the funding but wound up having to turn it down because they did not have the personnel to administer the fund. Even something that is that I would see as a gift, they could not accept because it would have turned into a burden.
Still, what Berkshire Regional Planning Commission helped build was something lasting, a stronger, more connected rural network.
None of this could happen without collaboration. Every single person who responded to an email of mine saying, hey, what's going on? And now I have relationships that have gone on about 3 years, even if we're not funding them, just checking in, telling them things that are going on that I think are relevant to their constituents. Again, bringing people together around the dental van. I wouldn't have had those networks, prior to all the outreach that I did.
This is the rural effect. When trust leads, partnerships grow, and the cracks in the system begin to close.